Today we're going to talk about AIDS. This is the virus that causes AIDS. This is HIV, human immunodeficiency virus. And you probably know this virus has stumbled upon a very successful evolutionary strategy. It's very hard to get HIV. Everyone knows how you get it, right? We've all been told. You can be born with it. You can get it through sex. You can get it by blood contact. But even though it's very hard to get, it's spreading. Why is that? We all know how to prevent it. Well, about a quarter of those who have it don't know that they have it. So that's a big problem. It's hard to prevent it if you don't know you have it. And it persists for years without any symptoms. So you know you have it for 7, 8 years before symptoms develop. So society faces this problem. We have people infected, don't know they're infected, possibly spreading the disease. We can prevent the disease by, of course, safe sexual practices, but that's rather tricky, right? We have, two people decide they care enough about each other to have sex. The issue of condom usage comes up. Who's going to bring that up? It's not very romantic, So your condom or mine, it's not something that maybe people think about very much, but they should, right? So it's a tricky thing there. And then we face also the problem of blood contact mostly between intravenous drug users. So there's another issue, another stigmatizing factor in terms of HIV. Obviously, drug addicts also know how HIV spreads, but they face a choice. Do they get their fix? Do they get their heroin or not? Can they get a clean needle? Probably not. And so this is another problem that arises. These are some statistics. We see that today about 34 million people infected. 2.6 million become infected every year, including 56,000 in the United States. So we see the magnitude of the spread of AIDS. Much of the problem today, many of the infected people, about 2/3 of them live in Africa. Sub-Saharan Africa is the most severely affected area of the world. And in Africa, of course, it doesn't have the same pattern of distribution as we see in the West. In Africa, it's almost entirely heterosexual spread, and of course, intravenous drug use. So it's a different pattern, but still a most severe problem there. But there are rays of hope, I guess you would say, that we've made advances. In 2003, only 50,000 people in sub-Saharan Africa and less developed nations were treated with antiretroviral therapy, anti-HIV drugs. Today, that number has leaped up to 5 million people in these parts of the world. So that's been a big advance. The more people are treated, the less the virus spreads, and that's a hopeful sign. However, we probably want to realize that the estimate is that 15 million people should be treated in these countries with these drugs, and they're not getting it. It would cost about $9 billion, present estimates, to treat everyone who needs to be treated, according to the Joint United Nations Program on AIDS. So treatment is available. We have better drugs now than we ever had before. The incubation period, you might say, the non-symptomatic period, because of those drugs, has been prolonged. People live for a long time if they get the right treatment. So it's become kind of a chronic disease, it doesn't hit as fast as it used to. So that's a good thing. There are also other problems remaining with the stigma of AIDS. Same-sex relations are still criminalized in 79 countries. 6 of those countries apply the death penalty to same-sex relations. And less than half of countries reporting have a budget for HIV programs for women. One of the big, ways that HIV can be prevented is empowering women in terms of sexual relations, and this is another problem with the spread. So the United Nations has put out this statement about the human rights. People should get tested. Why wouldn't you get tested? Well, there's stigma involved. People should identify their HIV status. Well, why wouldn't you identify your HIV status? Again, the stigma involved. So one of the big things that we can all do to help with the epidemic is to try to remove this stigma. Let's treat AIDS as a disease, not as a moral problem. Thank you.